Hi everyone, my name is Dr. Kimberly Brown. I'm a naturopathic doctor specializing in perimenopause. Tonight we are talking about testosterone for women. It's not just for men. When women go through perimenopause, their testosterone can drop. It can lower as much as 3 to 4 times as compared to when they were younger. It can also increase, and I have seen that a few times. And it's not always good. It can cause a rise in DHEA, which is a precursor to testosterone, and DHEA suppresses melatonin. So I've seen awful insomnia along with a very high sex drive. But for the majority of perimenopausal women, testosterone drops. And not only do they feel a decline in sex drive, they also feel a lack of motivation, increased anxiety, not being able to put on muscle like they used to, and in addition, brain fog. Oh my God, just had brain fog. So it's like, yeah, your brain just doesn't work like it used to. And it can be a real game changer for women in that way. They get their words back, clear thinking, motivated to do things, and feeling really good. I also think I mentioned anxiety and also depression. Testosterone can really help us feel more calm and sleep better because we're feeling calmer. So testosterone is really important in women, and unfortunately, medicine has ignored that. It's been like, well, you don't really need testosterone. Women don't need testosterone. It's not important. So some women, when they're menopausal, they come to me, they're only on estrogen and progesterone, and they desperately need testosterone. It's not often tested when we're younger, only in cases that we're suspecting polycystic ovarian syndrome, sometimes with infertility as well. Low testosterone can cause infertility in women. But in younger women, a high testosterone is associated with polycystic ovarian syndrome. It's not diagnostic though. Some young women simply have higher than average testosterone levels. I myself, being in naturopathic college, had my testosterone tested when I was younger, and it was really healthy. It was on the higher end of normal, still within normal range for a woman. And then when I got older, it actually dropped by half. So for myself personally, testosterone was a game changer, and I've seen that with my patients as well. Lots of different forms that testosterone comes in. It is available in a bioidentical form. Most of my patients are on topical creams. The reason why I like that is that we can adjust it easily. If they need more, they need less, it's super fast and easy to adjust versus other forms like injectable. Usually we use those just for men. And that's not my specialty. I specialize in women's hormonal medicine. But it will cause a huge rise in testosterone, and then it lowers, because typically women will only inject once per week, sometimes 2 or 3 times per week. But in certain conditions, certain patients, I should say, I will use injectable testosterone. But my preference is topical creams. It also can come in a sublingual troche, which goes under the tongue. I have a few patients doing it in that form. And then there's injectable pellets. Pellets are wonderful, but unfortunately if the dose isn't right, you're stuck with it for 3 months. So I have seen some women with very high testosterone levels. And unfortunately we just don't know the effect of high testosterone on women. So I like to really keep it within a physiological range where a woman is feeling good, they have their life back, they have their libido back, their energy, their motivation, and also, let me tell you the long-term effects of testosterone. It does help retain bone and muscle, because after age 35, you can't make any more bone. You're stuck with what you have. But it can help retain that, and that's actually why we don't see so much osteoporosis in men. Also because they do have higher in general have higher bone and muscle mass than women do. But that huge drop that we go through, not only with estrogen but with testosterone, it hurts our bones and our muscles as we get older. And one of the things that is very important to me is that my patients age healthy and feel good as they get older. So that is testosterone. If you have any questions, please post. I'd love to know what you're thinking about this, any questions you have, and I'm here to help. Testosterone is not just for men, very important for women. All right, everybody, lovely to see you this evening. Have a lovely evening, and I look forward to next time.